Thank you, Madam Speaker, and good morning, everybody. I'm honored to present a report on the activities of the Nieman Health Policy Institute to you all this morning. It was just 2 years ago at this meeting that I was informed of a decision by the leadership of the American College of Radiology to move forward with a plan to reorganize the health policy research activities of the American College of Radiology. Since that time, I had participated in a work group with Dr. Larry Miroff that was chaired by Dr. Bibb Allen to come up with an operational and organizational plan to move forward. And so it was just 3 months later that Dr. Ellenbogen made the announcement of the formation of the Nieman Health Policy Institute. We moved forward quickly in our activities, and it was just 2 months later that we brought a full staff on board. And in the 18 months since, we've really strived to develop the infrastructure to begin to execute our mission, which is to study the role and value of radiology and radiologists in evolving healthcare delivery and payment systems. One key rule of engagement that was dictated to us by the ACR's leadership to maintain the credibility of this organization is that our activities need to be at arm's length from the advocacy efforts of the college. And you see here a few of the bullet points that were in that outline, and we've taken those very seriously. While the Nieman Health Policy Institute came out of the activities of an old research group that was based largely in the economics group of the ACR, we now fit within the research pillar of the American College of Radiology. Now, my apologies to the real scientists in the audience for using the simplification of translational research, but the concept here is a really important and powerful one. It's to move from bench to bedside as quickly, effectively, and most meaningfully as possible. And we've really tried to leverage that model as much as possible, moving forward with our work in the most meaningful way to message to health systems, to patients, to other stakeholders and policymakers as effectively as we can, because they are the people that will continue to impact everything else that we do moving forward. Now, we live in a city, or we're here in a city, where spin abounds. And again, one of our goals is to maintain credibility, and that means that all of our work has to be data-driven. And so we've taken great strides to acquire a mass of data that hopefully will help us in those regards. You see illustrated here a number of various data sources that are quite laborious to obtain. The most compelling of these is we now have 9 years of contiguous claims data on a 5% random sample of Medicare beneficiaries. We can follow those beneficiaries through about 9 years of activities, and we're working to try to interlink these as possible to make the information as meaningful as possible to complement the important patient-focused clinical work that's going on in our academic centers. It's always important to remind people who aren't data geeks like me that there is a difference between data and information. When we receive these data under our data use agreements from CMS and other organizations, it comes largely unformatted, unpackaged, or in basically on hard drives. And so we have had to develop a data infrastructure to support our research team. To do that, we've developed a multidisciplinary team that I'm proud to be part of. It's about the size of the old research group that many of you are familiar with under Jonathan Sunshine's leadership in the past, but it's a team of an economist, of a public health researcher, biostatistician, epidemiologist, and a half-time radiologist, that's me, that work together in a collaborative way to be as meaningful and relevant as possible. And that really has been one of our guiding goals, is that everything that we do has to be as meaningful and actionable as possible to use the ACR's resources that have been granted to us as judiciously as possible. We really are only pursuing high-yield projects with important messaging potential and delivering that messaging in as many ways as possible. And that means that pretty much every project means that, can we enable, can we educate, inform, and train? And I'll just go through those individually. One of the charges put out to us in our guiding plan was to enable our individual members and practices to act appropriately as new, non-traditional payment systems evolve, and to help enable our ACR staff and physician volunteers to leverage the credible and accurate data and analytics that we work with and help others develop to accurately and credibly represent radiology and radiologists to various healthcare delivery system stakeholders. One of the tools in that regard, and I had shown you a mock-up, a non-functional alpha version last year, and I'm proud to announce that we now have a final beta version. We will be moving to another platform because quite honestly, the software vendors really can't handle the types of stuff that we're doing. But if you look at i3.neimanhpi.org, I just tweeted out right before I came on stage a hot link for those of you who are on Twitter. Play with the app. I'd encourage you to look at this with our inpatient imaging information decision support tool. Radiologists will be increasingly asked to participate in bundled payments for inpatient episodes of care. And this is a tool that will allow us to look at both hospital side, data's a little bit clunkier on that side, but more importantly and more compelling on the professional side of things, looking at Part B claims, which is for radiologist services, be able to pick up specific diagnosis-related groups, DRGs. Here's an example of pneumonia with major complications and comorbidities, and then look at sort of the robustness of the data that populates the subsequent information, over 17,000 claims and beneficiaries here, with mean Medicare professional payments to radiologists for imaging services, here in this example, $124, and that's largely chest radiographs and CT scans. And we see a lot of the underlying data below for annual years. We're hoping to move this forward in more robust ways moving forward, but obviously, hopefully a useful tool for you all at this point here. Now, we do need to, because we're thinking differently, fee-for-service is not going to be around forever. We do need to start educating people, all the stakeholders involved, about ways to think differently about medical imaging. And so we've spent a lot of time in outreach, innumerable meetings and conversations from our senior staff. We've participated in over 50 lectures and educational presentations in a variety of different forums to get people thinking differently about how radiologists will behave in future payment models moving forward. If you're a policy institute around here, you have to have a policy brief series, and we've launched that on an ad hoc basis with a number of different briefs. These are all available on our website, neimanhpi.org, to really get policymakers and researchers to think differently about medical imaging, because there is obviously a lot of misunderstanding about who we are and what we do in the minds of people who are quite influential in decision making. This is the era of social media, and we've tried to leverage that as much as possible, and so we've taken advantage, working with the public relations group, of blogs that are out there on vendors' websites, in radiology trade journals, and have managed to successfully find our home in a couple of the Inside the Beltway blogs that are out there, and hopefully really make sure that the messaging that we have, the data that we have, the information that we have is as impactful as possible. Now, it's great to talk about ideas, but we do need to have those ideas based in data, based in fact, and supported by reality. And that really has been our research mission, to inform people with real information. To date, in our 18 months, we've had 13 scientific presentations, either presented or accepted, starting first within our familiar spaces, but moving, which is part of the goal that was outlined for us by our advisory board, into a lot of other venues, health economists and policymakers, areas where we need to have people hear our messages. Today we've had 9 peer-reviewed publications, either in print or accepted, again starting in our familiar space, but moving out into the health economics and other spaces. I'm cautiously optimistic about a couple products that are in the work as we speak. But all this information alone really isn't helpful to our members and helpful to people, and so we do need to participate, as our resources allow, in training radiologists to use these data, use these analytics, to hopefully, because this has to be a grassroots effort in my mind, to pursue health services research and policy research, and also get non-radiologist health services and policy researchers involved in understanding our specialty enough that they're going to pursue work within this space. So those training initiatives have included a research symposium at the AUR meeting last year, and again this year we're going to have some activities at the RSNA to particularly show folks how to use business decision support tools that were created, and hopefully we'll have a pretty strong presence at the ACR 2015 meeting within these areas. We have moved forward with a seed grant program. 6 seed grants have been awarded, totaling over $250,000. You see the investigators listed on the right side of your screen. 2 of those have already resulted in accepted publications, and we have some other promising work going on by all of those individuals that we look forward to seeing. Now, as with any startup, we face challenges. Research funding is declining, and there's a huge anti-imaging bias in many areas in which we work. Securing ongoing funding to support this kind of work will be a challenge moving forward. And our mission's a broad one. There's only so much that a small group can do, but we continue to prioritize important projects for yield and impact to be the best stewards of the college's resources that we can. Thank you.